In your health right now, and a more severe strain of Mpox virus is now detected here in the United States. I didn't think we would be talking about Mpox just before Thanksgiving, but we are. Joining us now is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. All right, let's pick up with question one. As you know, the CDC has issued a national alert about this first case. It's in California, so obviously physically it's far away, but it can travel. Are you concerned?
I mean, look, I'm not concerned about the general public. Remember, we have Mpox in the country right now. We had an outbreak in 2022, 25,000 cases. That was called Clade 2. This is Clade 1. This person traveled to East Africa and picked it up there. So it's not like we're having person-to-person transmission of this. The good news here is that we have an effective vaccine. Again, not for the general public, but for people who are at high risk. Most of this is sexually transmitted. Or close contact, and we also have treatments, and we're hearing that this person does not need treatment. So although I don't know the specifics about the case, hopefully it's mild.
As you just mentioned, there is a vaccine for Mpox, right? So does it offer any protection against this particular strain that you're talking about?
Important, and it does. We think between these two clades, the Clade 1, this California case, tends to be more severe than Clade 2. Occasionally it can be fatal, but again, in this specific case it looks mild, and the vaccine is available. In fact, if you go on mass.gov, it's available at about 27 different sites across Massachusetts. So if you're in a high-risk group, this can protect. You need 2 doses. It's 2 doses a month apart.
Because I don't, you are saying the word clade, is that what you're saying?
It's type. Clade means type.
Clade 1, 2. Is 2 more severe than 1, 1 more severe than 2?
Generally, we think 1 is more severe than 2. 2 is the one that had the outbreak in 2022, and we're still seeing cases this year.
Should we talk about the bird flu? You've told us before you're tracking other viruses. Should we talk about the bird flu?
Eddie, I am concerned about the bird flu. Why? Because we know there's increasing cases in the United States, 53. Most of those have been animal to human, but there's a recent case in British Columbia, and that's a teenager who's fighting for his life. And the concern is also, that's on the heels of the fact that a pig has been infected. We know cows have been, but now a pig. That can be a mixing vessel. With seasonal influenza, upon us. That combination is concerning. Again, we are not day 1 of a pandemic right now, but I think the CDC and the USDA have to get together, and they're doing a lot of surveillance. I know they're working hard, but we need to hopefully see the fruits of these efforts.
So good. All right, Dr. Che, great to see you as always.
Good to see you.
Thanks for your time, Maria.